Welcome to this Learn at Work webinar sponsored by the journal Work, a journal of prevention, assessment, and rehabilitation. I'm Karen Jacobs. I'm the founding editor of Work, and I want to thank iOS Press for sponsoring this event. This is an exciting webinar. We have wonderful people who are going to be presenting, and I'm going to just kick it off and turn it over to them so that they can introduce themselves. You're in for a very informative webinar today. Thanks for joining us.
Thank you so much, Dr. Jacobs. I know I can speak for the entire team that we so appreciate you having us. My name is Megan Baumunk, and I am a certified rehabilitation counselor and vocational evaluator specialist and a doctoral candidate at the University of Wisconsin in Madison in the Rehabilitation Counselor Education Program. And I also work as a therapist and a group facilitator at Gilda's Club. And I'll let Chalet introduce herself.
Thank you, Megan. Thank you, Dr. Jacob. Hello, everyone. My name is Chalet Tan. I'm a postdoctoral research associate at the University of Illinois at Urbana-Champaign. It's very nice being here with you all. And I'll let Sandy introduce herself.
Thanks, Chalet. Hi, everyone. My name is Sandy Conder, and I am also a certified rehabilitation counselor. I'm a program manager and a training and development coordinator at the Human Development Institute at the University of Kentucky. And now we'll let Dr. Rumrell introduce himself.
Thank you, Sandy. Again, Dr. Jacobs, thank you for this opportunity. Always great to work with you, my friend. I'm a rehabilitation counselor by training, and I'm a professor of counselor education and director of research in the Human Development Institute at the University of Kentucky. I'm glad to be here with my colleagues on the panel today, and we appreciate everybody's willingness to tune in and share their time with us here. Thank you.
Thank you all. So we are presenting on this webinar, Post-Traumatic Growth and Trauma-Informed Care in Vocational Rehabilitation through the lens of conservation of resources theory. And before we dive in, just a quick acknowledgement and disclaimer, the contents of this presentation were developed under a grant, the Vocational Rehabilitation Technical Assistance Center for Quality Employment from the U.S. Department of Education. However, these contents do not necessarily represent the policy of the U.S. Department of Education and not assume the endorsement by the federal government. So in rehabilitation counseling, like most fields, we are consistently working and looking for more effective and more appropriate ways to provide services to the people that we serve. And in this work that we've done over this past year together, we believe that combining the concepts of post-traumatic growth and trauma-informed care through the framework of conservation of resources theory could lead to improved outcomes for people with disabilities in vocational rehabilitation programs. And we will review all of these concepts with a brief overview of what VR processes look like, and then we'll go into a conversation of how these concepts can be applied in each phase of the VR process. And I will turn it over to Chalet to get us started.
Hello, everyone. Thank you. Yeah, thank you, Megan, for the introduction. I'm going to talk about trauma, start with trauma and the relationship between disability and trauma. So when we talk about trauma in the Western concept, there are actually two views. One is the trauma in traumatology, which is more medical oriented, which is a timeless psychobiological entity. And the other is a more socially constructed phenomenon arising in the wake of Vietnam War. For example, the post-traumatic stress disorder under the Diagnostic and Statistical Manual of Mental Disorders is a diagnosis marker from the aftermath and individuals who've served in the war. So here we're actually talking about the latter, which is more of a socially constructed phenomenon. Of course, it also has a lot of psychobiological manifestations too. It is believed that trauma has high prevalence rates in the populations of people with disabilities. And this claim should be viewed from two perspectives. One is that certain type of the disability onset are traumatic. Using traumatic injuries as an example, a set of a 2015, which is a little bit outdated, but that's the most updated data I could find globally, that there are some around 40 million people permanently injured per year, and up to 100 million people temporarily injured, meaning that permanently injured, meaning that their disabling conditions cannot be treated, and temporarily injured, that their disabling conditions can be treated, and through rehabilitation, they can go back to their pre-injury status. Another perspective is that people with certain types of disabilities are more likely to experience traumatic life events. For example, people with intellectual disabilities are more likely to experience abuse and trauma compared to the general population due to discrimination or lack of resources. So people with disabilities are disproportionately impacted by trauma. And of course, post-traumatic stress disorder can be its own disability category and a common co-occurring condition along with other disabling conditions. So with this awareness, we also need to keep in mind that not all people with disabilities experience trauma. I did a disability grief study for my dissertation a couple years ago, and all my participants had acquired physical disabilities, such as spinal cord injury. When being asked about any loss being perceived during the onset and the adaptation process, some of them actually reported none. So we can't assume it is very individualized experience. Thank you. Post-traumatic growth is a fairly young concept, which were developed by Dr. Tadashi and Dr. Cowhole from the University of North Carolina in the early 1990s. In their book, they described their research process as discovering the phenomenon of the possibility of positive changes after an encounter of trauma. Of course, they're very humble, and it is also true that a collective effort towards operationalize this concept was made. One of the major pioneers they mentioned while explaining and defining post-traumatic growth, that's fundamental to the understanding of post-traumatic growth, is Viktor Frankl's theory on meaning seeking and creation. Viktor Frankl was an Austrian psychiatrist and a Holocaust survivor. And in the process of making sense of his own personal story as a Holocaust survivor, Frankl maintained that it is the individual's primary motivation and responsibility to search for the meaning in the midst of or in the aftermath of a chaotic situation. And such capacity allows the creation of positive outcome from an adverse event. So using his theory as an example of post-traumatic growth, it is important to note that post-traumatic growth is not about treatment or returning to the pre-trauma status, or sometimes clinicians would call it baseline. Rather, it focuses on the human potential of growth after trauma and how to facilitate that process. And post-traumatic growth can be viewed as a process as well as an outcome. Post-traumatic growth as a process is initiated by the traumatic event, and it is the effort of making sense of this event and reconstructing one's core beliefs. The process is individually different, and it is not always linear. The realization of post-traumatic growth as the outcome can be viewed as a positive change that result from a complex combination of cognitive, emotional, and importantly, social processes. So the process and outcome views of post-traumatic growth can provide different implications in the context of vocational rehabilitation. And next slides, please. Thank you. Employment is one of the many domains in which post-traumatic growth has been studied and theoretically applied, in addition to areas like bereavement, war trauma. First of all, if traumatic events occurred at workplace, which can be many different forms, such as work-related injuries, workplace harassment or abuse, or even denials of promotions or job loss. All these negative employment events can certainly cause distress or even can shake one's core beliefs. So when coming to serving people with work-related injuries or a history of negative work-related events, it is helpful to understand the impact of those events and identify some facilitating resources to promote post-traumatic growth to achieve employment success in the aftermath of those work-related trauma. From the perspective of work as a therapeutic and fulfilling part of life, whether the trauma is work-related or not, work itself can facilitate the process of post-traumatic growth, serving as a powerful vehicle. And next, I'll hand it over to Sandy, who will be talking about trauma-informed care.
Thanks, Chalet. So trauma-informed care establishes a combined methods that address the needs of individuals who experience events that are traumatic. It's not only providing that trauma-specific services, it assists in coordinating the continuum of care. Traumatic experiences really can change an individual's perception of service, seen as like that anxiety provoking or threatening, right? So the main goal is to incorporate knowledge about the impacts of trauma into each phase of service delivery and to provide individuals with safe and effective service environments. Retraumatization has been increasingly recognized as a barrier to health, rehabilitation services, and outcomes. Healthcare settings have found that unintentional retraumatization is the leading cause of consumers leaving programs early. Unintentional retraumatization is nearly impossible to prevent or avoid. However, if vocational rehabilitation counselors utilize the trauma-informed care with all consumers, there will be a reduced risk of retraumatization, even without requiring an understanding of what that individual's experience is with trauma. So infusing trauma-informed care into vocational rehabilitation services is important because the high prevalence and the increased vulnerability of exposure to trauma in the disability community. So now we're going to turn it over to Phil.
Thank you, Sandy. As we think about the issue of post-traumatic growth, as Dr. Tong talked about earlier, and trauma-informed care, as Sandy mentioned, we think about what kinds of mechanisms are required to help vocational rehabilitation counselors get a handle on the kinds of interventions and supports that we can provide to people with disabilities who may be experiencing stressful or traumatic life events, such as the onset of a disability, such as an unexpected change in one's employment status. In the conservation of resource theory, originated by Dr. Hopful and others, is a stress and motivational framework that holds rather simply that when people experience an event in their lives that they view as potentially stressful or traumatic, one indicator of how successfully they navigate that stress and perhaps come out the other end in the post-traumatic growth sort of outcome is their ability to marshal resources in their environment that can help them to facilitate their own decision-making and the choices they want to make about their life, their interactions with other people, and the way they engage more broadly with organizations, including employer organizations, including the community, to help to achieve their goals. Go to the next slide here, just one moment. Very important in the process of of thinking about the conservation of resources theory. And the next slide, very briefly, will go into the 4 categories of resources that are comprised within the theory. It's also important to note here that in working with folks and applying the conservation of resource theory, it is imperative to understand that the person themselves may not assign the same values to the resources in their life that the counselor does or that the healthcare professional does. And so the patient or client's values and cultural orientation to these resources have to supersede all other considerations. Ultimately, it's all about the person and their own construction, and it's the role of the practitioner to help to facilitate post-traumatic growth in this particular example today through increasing the capacity of people to utilize resources that are at their disposal to help to move themselves forward in pursuit of their whatever their goals might be. We go to the next slide, please. Thank you. Here's the 4 resource categories in Dr. Hopful's model. The first of these being personal resources, and these are status characteristics about the person, their demographic characteristics having to do with people's backgrounds, with their health status, mental health, etc. And in these particular examples, what we may want to provide here to address personal resources is a good example is personal adjustment counseling to help people identify what their career goals might be, mental health counseling, if that could be required, any sort of skill development kinds of activities they may be interested in. So helping to explore those immutable characteristics about the person that they certainly understand, but may or may not be viewing all the time as resources that can help move them along in their pursuit of their goals. So personal resources are really the most endemic to the individual. The next category of resources are what we call condition resources. And these have to do the life statuses and the relationships that people are engaged in. These could have to do with your relationships as a spouse, partner, or significant other, parent, leisurite, employee, professional, you name it. But these are the characteristics of the person in relation to the things that are going on in their life. And so here, what we can do to help to marshal this category of resources is to look at things like career and vocational assessments so that they consider how their own status, say as an employee, relates to their long-term career goals, how they can develop skills to function as effectively as they wish to in their employment situation, looking ahead to the next career step. These are the sorts of things that we do with folks having to do with the condition resources. Moving down, object resources is the 3rd category. I'm sorry for the delay here. I'm following my slides and they're just half a step behind, so please do bear with me. These are tangible elements in a person's life that can serve to facilitate or impede progress toward whatever their goals might be. These would include things like housing, transportation, access to a vehicle, access to health insurance, and therefore health care. And in looking at these object resources with the person who's experienced the disability, we may want to look at connections to social and other support services that might be able to help in financing supports that people might be requiring, connecting them to agencies in the community that might be able to help them with considerations such as social determinants of health. And so connections to other resources and referrals becomes a very important part of these object resources. Finally, in the fourth category, we're looking at energy resources, and these are tangible and intangible things like time and energy, of course, as the category implies, financial resources that the person can exchange and leverage to acquire things in the environment that can help to facilitate progress toward their goals, move them forward in whatever way they wish. And so understanding how they're using their time, using their resources, using their expertise. And a good example of this is helping people obtain additional training that might help them in pursuit of their career goals, going on for additional college training or vocational skill development. Let's say that a transferable skills analysis reveals they're not able to stay in their usual and customary occupation. We can exchange energy and time and money as needed to help folks acquire these skills that will continue to allow them to meet their goals. So in the aggregate, one's ability to succeed in managing stressful and sometimes, but not always, as Dr. Tong mentioned, traumatic events in their lives has to do with the ability to leverage these resources and sometimes to understand these resources and to see them as resources. Often people don't see the full range of things that they have at their disposal. And these four categories allow us to conceptualize these in, I think, a fairly meaningful way. So Sandy, I think we'll turn it over to you, and we're going to get more specific with some examples. Thank you.
Thanks, Phil. Yeah, so, okay, didn't want to go forward. So now we're going to really take a look at the state and federal vocational rehabilitation program. And of course, the purpose of the VR programs are to help individuals with disabilities prepare for, find, obtain, and maintain competitive integrative employment. So we're going to kind of focus on the four distinct phases of the VR process, which includes the eligibility determination, the rehabilitation plan development, the service provision, and job placement. I'm going to go and review like each of the four phases, and then Megan is going to jump in and she's going to discuss the application of the post-traumatic growth, the trauma-informed care through the framework of the conservation of resources theory for each phase. So we're going to get started with the eligibility determination. And with the VR process, we know that a person with a disability can refer themselves to the VR process, or that somebody else can refer them. But the first step is to go to that initial appointment where the counselor asks them lots of questions, right? They need to gather a lot of information. And at some point through that first meeting, they're going to sign that application. The individual with a disability saying they want to apply officially for vocational rehabilitation services. So that signed application means that they are now a VR applicant. And eligibility must be completed within 60 calendar days from that application date. So the clock starts ticking once that individual with a disability and the counselor both sign that application. And so during that eligibility process, it really involves two levels of assessment. So the first one is that preliminary evaluation, right? During that initial interview, all the questions, some of them are very personal, right? They have to gain a lot of information about their disability, about how it affects them, what they can do, what they can't do, or what they have trouble doing, things like that. And then the other is this thorough diagnostic study, right? So the counselor looks over and reads a lot of medical records, or however much medical records has been presented for the case. But the focus of the VR services during that eligibility determination phase is really on the documentation of the diagnosis and the functional limitations. So eligibility is based on the following criteria, right? So the individual with a disability must have either a physical and or mental health impairment that results in a substantial impediment to employment, who require and can benefit from VR services to achieve competitive integrated employment, and any other state's VR criteria, such as the order of selection, right? So just because a person has a disability and they apply for VR services and they're found eligible, the state may have enacted the order of selection due to limited funding, and so they may be put on a waiting list. So that's kind of the eligibility determination overview. Megan, I'll turn it over to you.
It's a great overview. When we're applying these concepts in eligibility determination, we're really exploring the current resources of the applicant. We're looking at all of the personal, the condition, object, and even energy resources in this process. And as Sandy alluded to, this can be a very lengthy interview. It can feel intrusive at times. It can leave the applicants feeling a little vulnerable. We're diving into a lot in these conversations, and it's just the beginning. So by using trauma-informed care, we can reduce risk of re-traumatization during these lengthy interviews, and post-traumatic growth is really beginning as a process. The interview, when there's hesitation or some resistance, or we just need to understand the utility of this lengthy interview, it can really be viewed as this product that can be emphasized as the first step in VR and beginning that growth and facilitating that growth in this first step.
You know, Megan, when I was a counselor for Kentucky VR, I always felt that I should tell every single person that I met in that first initial interview or meeting, that I was going to ask them a lot of very personal questions, right? And I always wanted them to answer whatever and however they felt most comfortable answering at that time. We never really know what they've experienced in life, and people don't always share everything, that they're dealing with in that referral. So when we meet them, right, we need to meet them where they are, wherever that is, not where we expect or we feel that they should be, right? So counselors need to gather a lot of that information, right? They need to ask a lot of questions, but we need to keep in mind that not all consumers are in the same place, and they're not all ready and able to move forward at the same pace. So if it takes 2 or more appointments to get through all of those questions that need to be asked, I think that's okay.
Absolutely.
Okay, so now we're going to look at the rehabilitation plan development. This means the eligibility has been completed, right? And now the VR is now the individual is a VR consumer or client. Just depends on what agency you're with. Vocational planning can actually occur prior to or during the development of the IPE, or the individualized plan for employment, which includes the VR counselor assisting with the career exploration, the development of the vocational goal, what kind of job do they want to get, and determining those specific services that that individual is going to need to be successful. The IPE must be developed within 90 calendar days from the date that that eligibility was completed, unless the state agency allows for and has a signed extension form from the consumer and the VR counselor. So the IPE should clearly reflect the consumer's interests, abilities, capabilities, and whatever individualized specific services that they need. Megan?
Thank you. Applying this in the plan development phase continues the exploration of current resources of the consumer. And typically that conversation, instead of just getting the overview of the current resources, we really start to dive into examining those resources, understanding needs and barriers in resources. And we see a lot of focus on personal and object resources. For example, for personal resources, we could be talking about self-advocacy skills, competence, working skills, employability skills, things like this. And then moving into object resources, understanding the need for transportation, like bus passes or assistive technology. These are common conversations during this step. Again, we're using trauma-informed care to reduce risk of traumatization and increasing feelings of safety. We're really focusing on building rapport and making this a safe environment to share what they're comfortable sharing. And post-traumatic growth continues as that process. And the neat thing in this stage is that it might actually occur as an outcome as well, as this intermediate milestone. And growth in this phase must be celebrated. It is so great to see that growth. And I think anybody who's worked in VR has been able to experience that growth in the IPE development. And it's such an important milestone.
Yeah, and you know, when you talk about the needs and the barriers and resources, during this phase, right, the assessments and the career interests, the discussions of what a consumer would like to do, you know, the skills that they have or the work experiences they have, or even they don't have, right? We really start to find out what they need to be successful and, you know, what specific services they need that will support them being successful. You know, I'm reminded of several consumers who were facing some huge life-changing and traumatic events along with their disabilities, right? And you know, they express some dark thoughts. And of course, we always want to follow up after hearing anyone make certain comments that might be dark, right? And I had already asked and knew that they were not and had never been in counseling. So I took that opportunity to offer some counseling sessions as a VR service because that was allowable in my state and because I knew that that service could potentially help them learn those coping skills, which ultimately can help a person retain employment once they are in job, you know, in a job. And you know, just because a person has experienced some type of trauma in their life, it doesn't mean that they have been in or are currently in counseling, right? And that they know how to deal or cope with those events in some positive way. Okay, so we're going to move right on to the service provision. So once the IPE has been developed, we then move them into implementation, right? This means that that consumer is now in the service provision phase, right? Referrals for whatever services that they might need that's been listed on that IPE begin to start happening. These services could include, but of course are not limited to, physical restoration, mental health treatment, like counseling sessions, academic and vocational training, personal and vocational adjustment services, of course, guidance and counseling, job accommodations, assistive technology assessment and services, and then, of course, job placement and on-the-job supports. And of course, this could also include these supported employment services. There's usually no time limits or specific designation for service provision, like this service must be started by this date and must end on this date. But some services might be quantified. For instance, the individuals that I would support putting mental health counseling on their IPE, our state agency regulation was that they could have up to 6. And then so that would be what would be put on the IPE. They could have a total of 18, but I always started with 6 because some individuals might need, 6 sessions, some might need more. And there's not usually a role of how that looks, right? That's where that individualization comes from. So one individual may want 2 counseling sessions a week and for 3 weeks and end up with 6, where another might be okay with just one counseling session a month so that it spreads out over a 6-month period. That's where that individualization really comes into play. So each IPE service should be provided in a timely manner though, right? And consistent with the consumer's goals and the career interests. Megan?
Thank you. The application in this service provision phase definitely gets a bit more complex, I think would be a simple way to put it. And this phase implements new resources to meet needs. We are taking those identified barriers and needs to resources and putting them in place and seeing how things work for the consumer. We are typically working on condition resources that result in energy resources. The clearest example here is getting employment that leads to income, that condition leading to energy. And trauma-informed care is, in my personal opinion, so important in this phase. Again, we're reducing risk and increasing feelings of safety, but this is a really unsettling time for many consumers. I think we can all agree that change is difficult. Quote unquote failing is difficult, and this service provision is a lot of trial and error, and it's not necessarily a failure, but sometimes it can feel like that. So making sure that we're really taking that trauma-informed care approach to the cyclical nature of this phase will help increase those feelings of safety. The other important piece in this phase are the triggering events. These triggering events start to become more identifiable, and we really do have to have clear communication plans put in place, and these plans are built among the vocational counselor, the consumer, and other service providers, so we know when a triggering event is occurring or feeling like it's about to occur. We can start that communication and respond before things get difficult. So with that approach, the trauma-informed care really does lead to post-traumatic growth. As consumers recognize triggering events, we're working with increasing coping techniques and building resiliency, and eventually reducing the risk of re-traumatization during these difficult situations. And that consumer and the counselor are prepared for different situations and experiences, and recognizing potentially unsettling situations before they get unmanageable, right? So we're acting rather than reacting, and that's a huge growth stage that occurs during service provision.
And you know, the term safety really stands out to me. I had a consumer who eventually shared with me that they were in an abusive relationship. So they didn't, trust very easily, and they never felt safe. It took a lot more time to build that strong working alliance, and at times their motivation came into question because of, all of the missed appointments, right? The scheduling, and then rescheduling, and then missing those appointments too. So I think it's really important to use that cyclical VR process, because some consumers are just not going to be able to progress in the same manner, right? And then the same timeframes as others because of where they are in their life circumstances.
Absolutely.
Okay, so this is the last phase that we're going to talk about today, job placement. And of course, when the IPE is implemented, right, and the services are the consumer is referred out for the services. So whoever is providing that job placement is going to start providing job placement services. This is where the goal is to help that consumer really prepare for obtain and maintain employment in that competitive integrative setting, right? Which is consistent, of course, with the consumer's abilities, capabilities, interests, and informed choices. The provider should help each consumer really develop those general and very specific employability skills, which can also help with job retention, such as they're first gonna, find out what skills do they have, what work experience do they have, how are those going to relate to the job, the vocational goal, and the jobs that they're going to be applying for, right? Job interview prep. Some people just don't know how to do a job interview. They don't know what to talk about. When, and I know this firsthand, when I was a counselor, I had a lot of people, I'd say, well, let's do a couple of quick interview questions real quick, just to see where they are. And I'd say, well, tell me about yourself. Well, they started telling me about, last Halloween and Christmas and the family picnic and the reunion. And it's like, oh, okay, well, we need to back it up. And, so we have to teach them those employability skills. We have to talk about the hygiene and the grooming and the wearing clean clothes and, all that, because not every consumer, it's that simple. So then, the job placement provider, or you can say return to work specialist or employment specialist or job coach, whatever their title might be, they also develop these employment opportunities with and on behalf of the consumer, right? Through direct contacts with the employers in that community, online employment opportunities, job search websites, of course, the ONET online system for labor market information and job searches within that their local state or area. So that's a quick overview. And Megan, you want to talk about the application?
Thank you so much. Applying these concepts in the job placement phase, counselors will ensure that resources and areas of needs are either being met or clear plans are made. This is a really culminating point in the VR process. And when we're kind of wrapping everything up and making sure things can be stable in employment, we're double checking those resources and those needs to ensure that we've covered all of our bases with the consumer. Trauma-informed care does not end. We are continually reducing that risk and increasing safety. And I think that really plays into building that resiliency and that safe space for the consumer. The post-traumatic growth is the desired ultimate outcome, with a couple of caveats. There's not an end point. We shouldn't assume there's an end point to growth, nor is there a maximum level of improvement. Growth will continue. And I think the thing that's important for me to remember as a counselor is, even after my phase of the services end, they go into job retention services. We successfully close the case with our consumer employed and satisfied at their employment. We have worked with the consumer to have tools and resources to prepare them for the cyclical potential of trauma and growth and employment. And many times we see that maintaining that stability in employment allows for just a superb amount of growth, and that employment success really increases growth. So we may not see the full effect of post-traumatic growth as the VRC, because we might be exiting the picture before that big increase of growth happens, but they will be prepared to continue to grow and facilitate that growth.
Yeah, it's interesting. We keep talking about post-traumatic growth as that desired ultimate outcome, which is amazing, I think, to look at it in that manner. And this really makes me think about how so many consumers start the VR process unmotivated, right? Due to either little or no work experience, not being able to get a job. Do you know how frustrating it is when, they come in and they're like, I've applied for 100 different positions and nobody will even give me an interview. So they start, not believing in themselves, right? They start to think that they can't are not, they can't get a job, or that they, they don't know of what kind of job that they could actually get, that they could be successful at. So they may appear unmotivated, but a lot of times it's just that self-doubt, that no confidence in their abilities or their value. So many times people are, they come in with that kind of attitude, but once they get that job, once you can see, some of the growth a lot of times, because they're happy, if they're doing well on that job. And, I just think it can initiate or enhance that growth. And like you said, Megan, we may not be there to see the big, growth that usually will come with being successful, retaining that job, whatever job that is in the community that they're doing, right? But VR does have the post-employment services. So when they are needed, VR can still continue to help support that growth.
Absolutely.
So Megan, you're going to wrap us up in conclusion?
Yes, thank you so much. With this brief overview of all of these concepts, I think the application of these concepts seems fairly seamless in the VR setting. And we believe with an increased awareness and understanding of trauma, counselors and other rehabilitation professionals can work with consumers in a manner that is safer and more responsive to their needs. And we are hopeful that this approach may improve long-term employment outcomes. And what we're really, really excited about is with input from vocational rehabilitation counselors and other rehabilitation professionals, comprehensive guidelines for each of these VR phases that we've talked about are currently in progress. So this work is not yet done, and we're so excited to continue to do this work. And on behalf of our team, thank you again, Dr. Jacobs, for having us, and thank you all for your time and attention for our discussion today. On the next slide is my contact information, and we are just so grateful for your time today. Thank you.
Thank you so much. Thank all of you. This was so interesting. I'm an occupational therapist, and as you were talking, I was thinking about the role of occupational therapy with all that you shared. And I learned so much from the conversation that you included in this webinar. So I just want to thank you. I think this is a real must for everyone to listen to. This was so comprehensive. I don't have any new questions, but I guess, thinking about the future, and I'm going to throw in generative AI, artificial intelligence, which everybody is, in academia talking about. Do you see any impact, or what impact do you think you'd see with Gen AI?
That's a great question. I utilize AI in a lot of my classes as an instructor, and getting the students involved with that and putting it into use with this. I think one of the potential benefits is really getting that robust understanding of trauma and how we can use that growth. I just think it would put a lot of that knowledge in more individuals' hands. And one of the things that I like to do is make case studies, and this AI puts together so comprehensive case studies and things that I hadn't considered, and it allows me to teach to very individualized experiences that aren't real experiences, right? So it allows us to have unique situations in our hands to then prepare as service providers with just a little bit more input. I'm curious if the team has other ideas, but that's my first thought.
No, that's a great one. And Dr. Jacobs, appreciate the question. I'm thinking of some of the work we've done together over the years, Karen, so I'm not surprised to hear you ask about technology. one of the things that I think of in terms of if what we're trying to do as part of the rehabilitation process is help people to identify and leverage resources that may be available to them, I'm thinking of how quickly and completely we can use AI and other technology to find out things about our environment that used to take, much longer than it does now. So instantaneously, we can find out where the nearest mental health crisis center might be in case someone needs immediate care, right? It's a kind of a silly example, but you can, within seconds now, right? We can find out where the nearest Starbucks is. We can find out where, I guess it's getting around lunchtime, but we can find these things out. We can find out where we can get transportation to and from work. We can find out all the businesses of a certain size that are within a 20-mile radius of our customer's home. And Sandy, I'm thinking of the work that you do on labor market analyses as well. That's not really AI per se, but we're really getting, in real time, we can get a handle on resources that people want and need to utilize to inform their rehabilitation process, to inform their career choices, to make sure they're getting the services and supports they need. And I could see this only enhancing post-traumatic growth as really the ultimate, outcome of the process. And as we're going to talk about modern technology, I think we've also got to talk about modern life and how stressful and traumatic for many people the COVID-19 pandemic has been, particularly for members of the disability community, how traumatic it's been just to watch the news or to watch the political process or what's happening in our communities. This has added a whole nother dimension to it. So just this technology and instant information can be used to solve some of these problems. It also has the unfortunate effect of illuminating them and bringing them into our consciousness also in real time. So Karen, I see it as sort of a little bit of everything, but it's all here to stay. So we've got to figure out how to use it to the most constructive, constructive purposes possible.
Yes, and it's in some ways it's the elephant in the room in academia, and we're addressing it head on by creating guidelines for responsible and ethical use, and we're teaching students how to use it correctly. And so I think that's an important role for us as professionals, to not be frightened of the technology, to really get to understand it, and there'll be jobs of the future that will be really helpful for the people that we serve. Phil, I just want to thank all of you for taking the time today to be with us. This was just such an interesting webinar, and we'll get it on our YouTube channel, make it available to many people. Just want to thank you so much, and I want to thank our listeners as well. Thank you for publishing in work as well. And last words, just thanks again. And everyone, be safe, be healthy, and take good care of yourselves. Thank you.
Thank you.